Hello, today I will be walking you through the PMCDX provider portal. To begin, please navigate to portal.pmcdx.com. Select the Collector/Medical Professional tile. Using the credentials provided to you, please sign in. If you are a new user, it will prompt you to set your password. Enter the temporary password into the old password and set your new password. To order a test, navigate to the bottom of the dashboard and locate the requisition forms. The requisition forms are divided into three categories: infectious disease, pharmacogenomics, and genetics testing. Select the desired requisition form for the collective sample. In this demo, we will prepare and order for a urine sample using the urinary tract infection form. Scroll to Section 1, Ordering Physician/Laboratory. The physician code and the practice code will auto-populate for your clinic if there is one ordering physician per clinic. If it is not auto-populated, select the physician and practice code by clicking on the magnifying glass and searching for the appropriate selections in the name search fields. Double-click on the provider's name to make the selection. Add an electronic signature in the box by selecting the green plus sign New. You can use the pencil or select T, enter text, and record a physician's signature. To save the physician's signature, please hit Submit. Section 2, Patient Information. Complete all the light blue fields with patient demographics information. If the patient has been tested previously, select the Patient Search button and use the fields to search for the appropriate patient. Double-click to make the selection. All demographics information should populate. Review this information and ensure that it is accurate and up to date. Section 3, Billing Information. If the patient search feature was used in Section 2, the patient's insurance should auto-populate in this section. Review this information and ensure that it is accurate and up to date. To add new insurance, select the green plus sign and search for the appropriate selection in the description search field. Select the order position by clicking on the drop-down arrow in each row. Enter the policy number and group ID. If the patient is paying out of pocket for the test, select self-pay and input NA in the policy number and group ID cells. If the patient has already made a payment for the test using the provided QR code/coupon, indicate the paid status to yes. Attach the coupon with the requisition form upon completion. If you are unable to locate the correct insurance payer descriptor, select Other and enter the insurance name in the box below. Upload images of the front and back of the insurance card by selecting this box. In the pop-up window, select the green plus side Add. Select the ellipses to choose the insurance images files. Select Insurance for the category. Once finished, you can close out of the pop-up window. Section 4, Patient Consent. Collect patient consent and select the appropriate checkboxes on behalf of the patient. Enter the patient's full name and the patient consent date. Section 5, ICD-10 codes. Type in the diagnosis or ICD-10 code in the box. To list more than one diagnosis or ICD-10 code, separate by comma. To search for any code, select the magnifying glass and search for the appropriate selections in the description search field. Double-clicking will select the code and it will appear in the selected items. Then click OK. Section 6, Test Panel Selection. Choose a desired test by clicking the checkbox next to each panel. Note that if the physician would like to order antibiotic resistance marker with the panels, only the checkbox next to the antibiotic resistant markers needs to be checked. Uncheck the checkbox next to the panel with the pathogens only and select the checkbox next to the panel with the antibiotic resistance markers. Section 7, Specimen Information. Select your specimen type by clicking on the drop-down. The specimen description will auto-populate. Select the container type. The container description will auto-populate. Select the collected checkbox. Select the date of the collection using the calendar and the collection date and time. Change the time as necessary. Enter the name of the individual who collected the sample. For urine samples, typically it is a self-collection. Select all attached tests available. Section 8, Clinical Information/Justification. Enter any notes the ordering physician documented during the patient's visit to indicate necessity of the testing. If it is easier to upload the medical progress notes directly from the EMR, select Upload Clinical Documentation and add the document. Select Documents as a category. Section 9, Provider Acknowledgement. Review and select the checkbox. When the requisition is finished, scroll to the top of the page and select Submit to Lab. Once an order number is generated, the order has been successfully submitted to the lab. Select the requisition report to view the completed requisition. Print the completed requisition and place it in the outside sleeve of the sample's biohazard bag. To return to the dashboard, select the PMCDX logo in the header. To view results, select the Client Dashboard tile. All new orders will be visible at the top of the list. If you do not see a completed report for the patient, open the search criteria bar on the left-hand side of the page. Search for the patient's first name and last name using these fields. Ensure that the text is in all caps. The most recent report will populate on the top. When the report is located, select the paper icon in the Reports column. A pop-up window will appear with the attachment. To return to the dashboard, select the PMCDX logo header. Feel free to reach us for any questions or if you would like to schedule a demonstration to review the provider portal.